Hi, it's Lauri Kane from the office of Dr. Dean Kane at Dermatology and Advanced Skin Care in Columbia. Today we are seeing a lot of patients who are losing weight, whether they're losing weight naturally by exercise and dieting, or they've added in the weight loss drugs like Ozempic, Zepbound, Mounjaro. But we are seeing patients that are starting to lose a lot of volume in their face as a result of this rapid weight loss. An example of what the Ozempic face is, as you see in this next picture, is a woman where she's losing volume and fat in her temples. She's losing fat under her eyes, a sunken eye. She has a gaunt look in her jawline, and she has developing nasal folds and marionettes. And that's what this picture is demonstrating, that there's a lot of weight loss and fat loss in the face and a lot of volume loss. Now, what's happening under the skin? So you can understand what's causing this hollowness and sunkenness. So in this next picture, you're going to see the diagram of a woman where she's youthful, her fat pads are highly connected to each other, and her face is smooth. In the next frame of that picture, you'll see that as the fat pads start to shrink, and you start to see the pink that's now separating the fat pads, that pink is your muscles of your face. And what's creating the hollowness is the loss of fat. So the more pink that's showing, the more the fact that you've lost this fat volume. And by separating these fat pads, we're getting, you start to see hollowness throughout the whole face. On top of that, you're seeing that the skin laxity is greater because we don't have the volume that's holding up the skin. With aging, we naturally lose collagen in our skin, but with the rapid weight loss, we're seeing the skin laxity even faster. So what Dr. Kane is doing to help his patients restore the volume and the skin elasticity, we have a two-step process. First, we need to fill the volume. So we have two problems. We need to fill the volume, and we need to deal with the skin laxity. To fill the volume, we actually use filler. And as you see in the next picture, this woman, Dr. Kane, used fillers in her temples, in her cheeks, along her nasal fold, and even in her lips. And you could see what a natural rejuvenation she had just with fillers. And that's instant. So the whole goal is, while you're losing weight or during the weight process or even after, you need to restore that volume, and actually fillers is the best and easiest way to do it. So that's the first step. The second stage is to restore the skin thinness or the loss of collagen, and get back the skin to be firmer, tighter, and more elastic. With that, we're using Sculptra. Sculptra is a biostimulator that actually stimulates the collagen of the skin. It forces the skin to make collagen when it actually doesn't want to. And with weight loss, we're losing that collagen even faster. With aging, we lose collagen. So the goal of Sculptra is to stimulate collagen in the whole face, and then that causes the skin to actually have a much more structural, firmer dermis that gives us a nice tightening and firming of the face and lifting of the face. So that solves really both problems. So in the next picture, you're going to see a woman where we did both treatments. We did the filler under her eyes, we did filler in her nasal fold, and then we did 2 Sculptra treatments. And this is her pictures 3 months later. And you see that she looks so naturally rejuvenated with this combination of fillers and Sculptra. Now, Sculptra lasts a whole year, and by the end of the year, you actually look younger than when you started. And so Sculptra truly stops the aging of the face and reverses aging. But every year, you have to keep it up to maintain this youthful look to the face. So we recommend coming every year. One more little piece to talk about is, the fact is we have to inject the whole face. But Dr. Kane has come up with a cannula technique in which he's only doing 4 injections to the face. First he numbs the face in the cheeks and then in the jaw lines, and then through these tiny little injections, after he numbs it so there's very little pain or almost no pain, he has a long needle called a cannula, and he's inserting the Sculptra through that tiny little injection. And he does this way, and then from here he goes to the lower face and the jawline. And I promise it's minimal bruising, minimal pain, and you do have to massage, which we will teach you, but that is the technique he's using, and our patients are loving this new technique. It's fantastic. And so that is going to reverse the Ozempic face by actually doing a volume, increasing volume with filler, and then using Sculptra to help tighten and firm the face. If you want to learn more about this from me, you could talk directly to me. Call 410-602-3322, and you could always email me at Lauri@drdeankane.com, and I can also make your appointment for you. So I'm looking forward to hearing from you, seeing you, and wish you all the best on your weight loss journey.